How are retina surgeries done? This is Dr. Anina Abraham from Advanced Retina Care. I have with me the model of the eye, and I'm just going to show you what exactly happens when we do a retina surgery. We don't cut open the eye in order to treat the retina. Small instruments are passed here in the sclera of the eye, and these instruments, once they go into the eye, you get to see with a lens. A non-contact lens is normally used, and this lens is able to see through your dilated pupil onto the retina, which is behind. So once we pass these instruments inside the eye, we are able to see the retina, which is behind the eye, and we are able to cut the vitreous. The vitreous is the jelly inside the eye. So these instruments passed inside cut the vitreous, which is inside the eye. This vitreous is replaced with solution, which is again coming in through one of these ports. That solution is a clear solution. It gets absorbed eventually. It's not a permanent solution which is going to be inside the eye. So everyone asks me, then what happens to this jelly? Does it ever come back? Once you operate it, does it come back? No. Once the jelly is removed from inside the eye, it never refills, because you are born with the vitreous. You can never replace the vitreous. But in retina surgeries, we replace it with a fluid. Sometimes balanced salt solution is used, or Ringer's lactate is used, and this replaces that, and that's why the shape of your eye remains. Sometimes oil is used to fill the cavity. That oil is not a permanent thing. That oil has to be removed from the eye, and once the oil is removed, it is replaced again with the fluid. Now the fluid also gets absorbed. So what happens is there is a place here which secretes fluid, aqueous, and aqueous starts going behind and replaces that. And that is more like a permanent thing. So aqueous is produced all your life. It's always produced inside the body, and that goes behind and fills the eye. The important thing to understand is, once this vitrectomy is done, it is important to check the retina. What we do is we check the retina, make sure that the retina is attached in place. If the retina is detached or lifted, what is required is the jelly is removed and the retina is pushed back. Now, how is that done? There is a procedure called fluid air exchange. You pass a flute needle. It's basically an aspirating needle. You pass it into that area of the retina which is detached, and you exchange it with air. So the fluid under the retina comes out, and the retina gets pushed back, and the eye gets filled with air. So this is called a fluid air exchange. After this is done, those areas which are weak on the retina undergo laser treatment. So this endo laser is different from the other barrage laser which we do, different in the sense that that is a procedure which is done in the OPD, whereas this one you have to actually go inside the eye with instruments and then pass laser directly onto the retina. The difference is, you can see this very clearly, but again you have to be very careful with the intensity of the burn which is produced, because you're very close to the retina. So this laser is meant to close those breaks, and then finally oil or gas replaces this fluid so that your retina continues to be attached. Once the retina is attached and the breaks are completely closed, we can remove that oil. If it's gas which is injected, you don't need to remove the gas. The gas automatically goes after some time. Once the procedure is completed, in cases of diabetic vitrectomy, there are lots of membranes on the retina. Those membranes have to be trimmed off. Along with this jelly is removed, and the membranes are all cut and trimmed, and that's what settles the retina. Once all this is done, then the instruments are removed from the eye. So once you see the eye after surgery, it doesn't look like surgery has been done or any cuts have been produced on the eye. It looks like it has been unoperated. That is the beauty of retina surgery. So remember that this is a sutureless procedure. There are no stitches required, because these instruments are very fine instruments which go into the eye.